Hi guys, this is the last of a set of 3 videos that I'm doing on tapeworms. If you want a more complete discussion of what a tapeworm is, how it develops, and the different anatomical structures of a tapeworm, check out my Tania video. In that video, I talk all about basically cysticercosis, the pork tapeworm, and the beef tapeworm, which is T. saginata. But I'll go over a couple of the things here. So Echinococcus granulosus is in fact a tapeworm. Tapeworms are also known as cestodes. They're all helminths because helminths basically just means worms, okay? So let's talk about Echinococcus granulosus. First, like I mentioned, it's a tapeworm. The main things you want to keep in mind, the scolex is the head. Each of these little segments is known as a proglottid. When you string enough proglottids together, you have a strobola, okay? Now, there's one form here that I haven't really talked about that's going to be really important in this one. When we think about the life cycle of Echinococcus granulosus, there's a stage called the Anka Sphere. The Anka Sphere is actually a 6-hooked larval stage that is able to attach and penetrate the human intestinal wall. And that is actually what allows the organism to enter the circulation and be able to be carried to various tissue sites. This is the same thing that happens with T. solium, which leads to cysticercosis, particularly neurocysticercosis. Okay, Echinococcus granulosus. Like I said before, it's a cestode, i.e. tapeworm. Infective stage, egg. When you ingest contaminated water or vegetation that has the E. granulosus egg, that's when you're at risk, okay? Our diagnostic stage, though, is actually a cyst, okay? Where do we get it? So we are actually an accidental host of E. granulosus. It doesn't want to be in us. We are dead-end intermediate hosts in a life cycle that occurs naturally in lots of other animals. If E. granulosus gets into us, it can't finish maturing. It's just kind of frozen in time. So where would we find an adult tapeworm? Adult tapeworms are typically found in the GI tract of canines, dogs, and the dingo, as well as jackals and wolves and all sorts of other canine creatures. The larval cyst stage is present in the viscera of herbivores, moose, elk, and sheep, for example. In fact, sheep herding, main risk factor for developing E. granulosus. So when the eggs are ingested, once again, they're going to develop in the human into that Anka Sphere, and it's the Anka Sphere that's actually going to lead to disease. The primary sites for this Anka Sphere to kind of circulate to are actually the liver and the lungs. They are known to also penetrate the CNS and the bone, but liver and lungs are kind of your main stages. Okay, so where do we see it? Mainly sheep. E. granulosus infection is directly correlated with raising sheep in many countries in Europe, South America, Africa, Asia, Australia, New Zealand. It does occur in Canada and the United States. In the United States, we tend to see this in places where we have a lot of contact with herbivores. So for example, Alaska. Sometimes I watch, those like beautiful like Planet Earth type shows, and they'll show you all of these, elk and other herbivorous creatures kind of frolicking through the wild that is Alaska. Well, when you get too close to those, they might give you E. granulosus. Utah, New Mexico, Arizona, California, and the lower Mississippi River Valley, lower Mississippi Valley. All of these are places where we might see E. granulosus. Human infection is going to occur after we ingest contaminated water or vegetation. So think about that. You're out hiking in Alaska because that sounds fun. You run out of water, you find what you think is a clean stream of water, you fill up your canteen and off to the races, right? But if that water is contaminated with, wolf feces of a wolf that has E. granulosus, or elk or moose or whatever other pretty animals they have up there, that could be infective eggs that could lead to the development of E. granulosus. Now, here's the rub. The cysts for E. granulosus grow really, really slow. 5 to 20 years may pass before any symptoms may appear. So you might have done this camping trip when you were 15, but you're not feeling it till you're 35. So just something to kind of keep in mind. In some cases, the cyst might even be as old as the patient. The pressure, what happens is that as this cyst grows, because the worm can't mature, so we're just kind of stuck at this oncospheric cyst phase. The pressure of the expanding cyst in an organ is usually the first sign of infection. Most of the infections, like I said before, are found in the liver or the lung, okay? So what does that mean? In the liver, the cyst may exert pressure on both bile ducts and blood vessels, and that's going to create pain and biliary rupture. In lungs, the cysts, as they grow, they're going to produce cough, dyspnea, and chest pain, okay? When rupture occurs, though, that's a problem. If that cyst ruptures, we got a big issue, because now we have all of these things. So I'm just going to put on my immunology hat for just a minute, and I want you to think, this is a parasite. If we have a parasite, a lot of parasite that have just ruptured out of a cyst, we're going to have eosinophilia and mast cell and basophil activation. That's bad news bears. So we're going to have fever, urticaria, and occasionally you can even get anaphylactic shock and death as if you were just exposed to a mass allergen. So how are we going to diagnose it, and how are we going to get rid of it? So diagnosis is a little tricky because really what you're looking for is this slowly growing cyst. So really you need to do radiologic examination, okay? So by radiologic examination, what do I mean? CT, ultrasound, these are all valuable and may provide the first evidence of the cyst's presence, okay? How do we treat it? You need to get rid of the cyst. So the best thing to do, get rid of it, cut it out, surgical resection. This is your first choice. The cyst is first aspirated to remove the liquid and the hydatid sand, then instilled with formalin, basically to kill and detoxify the remaining fluid, i.e. get rid of the parasite. Finally, it's rolled into kind of a marsupial pouch, which I just like saying that, marsupial pouch, and sewn shut. It makes it sound cute instead of a deadly parasite. Okay, if the cyst though, we can't really control where this grows. If the cyst grows in a spot that's completely inoperable, what do? So first choice, give them some high-dose antiparasitics. Albendazole, mebendazole, praziquantel, all of those may be considered. So wouldn't it be better just not to get this cyst in the first place? I agree. So what are we going to do? We're going to try to prevent it. The best way to prevent echinococcosis is through education, like you're doing right now, good personal hygiene, making sure that you're drinking from clean water sources, and take care of our puppies. Canines are a great place where we might find granulosus, so make sure that they're also drinking clean water and keep an eye on them.